Sleep, something again that I don't know that's always taught. People are curious about, and they see all the squiggles and waves and don't know what to do with them. I wouldn't worry terribly about those. I'll just go over some of the anatomy that's important and maybe some disorders quickly. Think about your circadian rhythm as everything that your body does to help internally make sure that you have a 24-hour or slightly less than 24-hour sleep-wake cycle. You're awake when you need to be awake and asleep when you need to be asleep. The kind of the buzzwordy things that you should know about are orexin or hypocretin are the neurons that stimulate wakefulness. And I often think a lot about sort of brainstem as being something that's really helpful for wakefulness, the reticular activating system. To sleep, you should think about how we get sort of dark cues from our eyes back to some central parts of our brain. Think about the pineal gland and melatonin, right? And so melatonin becoming very popular over the counter for sleep aids. Biochemistry review, remember melatonin comes from serotonin. Serotonin comes from tryptophan. That sort of plays into the Thanksgiving lore that turkey makes you tired. Turkey's high in tryptophan. So the thoughts are that that makes why some of those foods make you sleepy. Normal sleep, you should have stages. And then each cycle has multiple stages in it. You should go through a couple cycles of sleep. So you progress through non-REM sleep in sort of a dedicated phase. And then you have a period of REM sleep. As you go on, the amount of time you spend in REM sleep in each cycle goes up. So the first one, you might only be in REM for a few minutes, then later, then longer, then longer. I like this phrase that a REM sleep period is an inactive body. You should be paralyzed, more or less, with an active mind. So with that in mind, when you think about something like sleepwalking or REM behavior disorder, nightmares, and sleep terrors, I think it becomes a little easier to sort out which one happens in which phase of sleep. And this actually comes up not uncommonly on things like the neurology shelf and the pediatric shelf. So something like a nightmare, which I imagine many of us have had, we typically remember the dream. We typically have an active mind. We typically have an inactive body versus a sleep terror where people will be not remember, will have like this visceral, like sit up and scream and be terrified of what's happening. You can sort those out and whether or not they happen in REM, non-REM by thinking of the inactive body, active mind part of REM sleep.